And it's not just in the national capital and the NCR region. In states like Uttar Pradesh, Punjab, Jammu and Kashmir, where you're typically expected to be much colder than in the Hindi heartland, there is a massive onset of the dengue virus. So why is this happening? What can be done to counter it, and how can you be safe? At this moment, we have people in our office who are down with dengue.
It is true that we are in the midst of quite a serious wave of dengue. The hospitals, at least I can talk about my own hospital, we have had between 80 to 100 cases admitted with dengue, and you know that that's only the 5% that needs hospitalization. That means multiple other people have got the dengue, but they don't need hospitalization, but still they suffer very severe symptoms. So as far as hospitalization is concerned, we are seeing a much more virulent form of dengue this year than we have seen in the past 1 to 2 years.
The rains have come late, and intermittently very heavy rains have occurred, and they have allowed the mosquitoes to breed, and I think that could be one reason. Besides, other is this time it is a severe infection. The reasons are not too clear, the same strain, but what we have seen is so many cases of dengue shock syndrome. Means people have come, they have low blood pressure, they have very severe liver injury, as Dr. Trehan also said.
That especially in a place as cold as the Kashmir Valley or in Jammu, which is relatively cold, at least in comparison with the rest of North India, the dengue situation wouldn't be so bad. So how bad is it around where you are, and what's being done on the ground to try and counter it?
This second wave of COVID, when it subsided in around May and June, we were caught up with dengue around mid-July. So the disease kept on spreading very rapidly. In fact, our GMC in Jammu, it got overburdened with a lot of rush as far as these dengue patients are concerned. 90% of these patients, they can be managed at home. So very less number of patients, if fever is not subsiding, or patient has a frank bleeding, patient goes into hypotension, patient is in shock, or the sensorium gets altered, or some major organ is involved.
Dr. Bedi, how are things in Chandigarh?
It is a very difficult to establish as to which patient is going into a very severe and potentially fatal illness, and which patient is going to land up with very asymptomatic and a very mild kind of illness. We have already seen that those are already, falling short of beds. So you may go to your family physician, which is close by your residence in your locality, and there you can monitor, go to a lab which is a good lab, and keep your lab tests maybe if they're required every alternate day or every day, depending on what your doctor says.
The questions that will arise is what happens therefore to an individual's right to breathe every year? Is there no political will for tough decisions that can ensure that these air emergencies can be in some way mitigated? Why is pollution in some way not on top of the mind of all governments, be it the Delhi government, be it the Punjab government, be it the Haryana government? Is there an ideal solution where we can resolve a crisis that year after year seems to be only worsening?
You're obviously asking me this question at a time where a lot of the contribution is coming from outside of the city. But if you just average it out throughout the year, you will find that, there's a lot of sources which actually exist within the city. So yes, the sources, yesterday, today, tomorrow, and possibly for the next few days is going to be largely, possibly even as high as 60%, because this year, the Parali burning was actually on the lower side up until end of October, and it's really just picked up in the last week or so, and significantly, because the farmers did not have the space to burn it. But there are enough other sources to be blamed within the city itself. So I think it becomes a soft target around this time of year because it's viscerally there in your face.
So if we look at the data actually which we were following, this is the graph which shows that this year we are seeing even higher peak of the crop residue burning. Interestingly, we are seeing 50% increase in crop residue burning in Haryana, and similarly we are also seeing higher fire count over Punjab. At this moment the Punjab fire count are the maximum. We need to understand that I am in Chandigarh, and we are seeing moderate air quality. Why they is now choking up? The reason is, first is the meteorology. The meteorological condition at this time, they favor the atmospheric boundary layer lower down, and the emission remain the same from the city.
Individuals must have the right to breathe, and maybe citizen groups are going to have to put pressure even of a greater amount beyond just environmental activists. Make this a people's issue. There are elections for the municipality in Delhi, for example, that come up in a few months. Make this an issue. Can citizens push for ensuring that air pollution and the quality of clean air becomes a political issue and put pressure on the systems to at least collaborate? You need different states to work together to provide clean air.
If you were to see, Delhi government is probably one of the only governments which has actually had a year-long plan to combat pollution. Delhi government is the one which has provided 24/7 electricity and taken diesel generators completely out of Delhi. You will not find any other state, any other city across the government that does not use diesel generators.
The AAP government has certainly tried, but the reality is that the PUSA solution, for instance, right, necessarily means that the shorter yielding variety of rice is the one that has to actually be planted in Punjab and Haryana. And we've heard from the PUSA director himself, who said that standalone solution on its own to the crop residue burning problem. But the problem is the farmers of Punjab and Haryana feel that if they use this shorter yielding variety, the shorter time yielding variety, their yields go down, and as a result their revenues go down.